Bubbling feeling in the chest. Main causes. A bubbling feeling in the chest is a sensation that a person might describe as cracking, gurgling, or as if a bubble is about to burst. Many people experience it and it has a variety of causes. Treatment depends on the cause. This bubbling feeling is linked to a variety of conditions that range from mild to severe. The sensation may appear alone or occur alongside other signs and symptoms. People with a bubbling feeling in the chest should always see their doctor for a diagnosis. Possible causes. Here we explore some common causes of a bubbling feeling in the chest. Asthma. People with asthma may experience a bubbling sensation in the chest. Asthma is a lung condition that involves swelling and narrowing of the airways. It affects approximately 25 million Americans. Other symptoms include coughing, shortness of breath, tightness in the chest. Asthma may be triggered by allergies, exercises, certain types of weather. Most people can manage their asthma with lifestyle changes and medication. Atrial fibrillation. Atrial fibrillation is an irregular heartbeat, often one that is faster than normal. It happens when the upper chambers of the heart are out of sync with the lower chambers. Other symptoms can include chest pain, dizziness and confusion, heart palpitations, shortness of breath, tiredness, weakness. Atrial fibrillation requires medical treatment. While it is not usually life-threatening, it can lead to complications such as blood clots in the heart. Bronchitis. Bronchitis causes inflammation of the tubes that connect the lungs to the mouth and nose, which are called the bronchial tubes. It may be short-term or acute, or last 3 months or more, which is considered chronic. Other symptoms of bronchitis include chest tightness or pain, chills, a cough, mild fever. Treatment depends on the type of bronchitis a person has. Acute bronchitis is usually treated in the same way as a cold, and symptoms will typically go away in 10 to 14 days. Treatment for chronic bronchitis may include inhalers and oxygen therapy. Collapsed lung. A collapsed lung or pneumothorax happens when air leaks from the lung into the area between the lung and the chest wall, as well as the bubbling feeling. A collapsed lung can cause a bluish tone to the skin, fatigue, flared nostrils, low blood pressure, rapid heartbeat. A collapsed lung can occur suddenly for no reason or be caused by injury, a medical procedure, lung damage. A collapsed lung should be considered a medical emergency even when symptoms are mild. Symptoms typically resolve quickly and there are usually no future complications with prompt treatment. Gallbladder inflammation. Inflammation of the gallbladder or cholecystitis can be caused by blocked bile ducts, tumors, or infection. Symptoms often flare up after eating, particularly if the meal was large or high in fat. Symptoms include fever, nausea, pain in the upper right or center abdomen that may spread to the right shoulder or back, tenderness above the abdomen when touched, vomiting. Some people may also notice a bubbling feeling in the chest. Treatment involves antibiotics, painkillers, or gallbladder removal. Untreated gallbladder inflammation can lead to serious complications, some of which can be life-threatening. Gastroesophageal reflux disease or GERD. GERD involves the rise of stomach acid into the food pipe. GERD can cause a bubbling feeling in the chest pain, a cough, difficulty swallowing, feeling like there is a lump in the throat, heartburn, which is a burning sensation in the chest just behind the breastbone, a sore throat, sore taste in the mouth. GERD can be caused by bacterial overgrowth, frequent use of over-the-counter painkillers such as aspirin and ibuprofen, excessive intake of alcohol. The usual treatments for GERD and heartburn are medications and lifestyle changes. Indigestion. Indigestion is pain or discomfort in the upper abdomen that can cause a bubbling sensation in the chest and gurgling in the abdomen after eating. Indigestion is also known as dyspepsia. People may also experience bloating, heartburn, nausea. Dyspepsia can be caused by eating too quickly or too much, excessive intake of alcohol or caffeine, fatty or spicy food, smoking, some painkillers and antibiotics. Treatment involves lifestyle and dietary changes as well as medications. Pleurisy. Pleurisy or pleuritis involves inflammation of the thin membrane that lines the inside of the chest cavity and surrounds the lungs or pleura. It is caused by an underlying medical condition. Symptoms include sharp chest pain that gets worse when breathing, coughing or sneezing, shortness of breath, a cough and fever in some cases. Treatment involves addressing the underlying condition and managing pain. Pleural effusion. Pleural effusion occurs when fluid becomes trapped in the space between the lining of the lung and the chest wall. It is often a symptom of another condition such as cancer, congestive heart failure, injury to the chest, pneumonia. Symptoms include bubbling in the chest, cough, and shortness of breath. Lung tumor. A lung tumor may be linked to bubbling feeling in the chest. In rare cases, lung tumors may be harmless or cancerous. Many people with a lung tumor do not develop symptoms until the tumor has been there for many months or even years. When symptoms are present, they may include chest pain, coughing up blood, fever, a persistent cough, shortness of breath, weight loss. Pneumomediastinum. A condition called pneumomediastinum may lead to the symptom of bubbling sensation in the chest, although this is an uncommon cause. This condition is caused by trapped air in the middle of the chest, under the breastbone and between the lungs that results from injury or air leakage. This is not always an obvious explanation, but people with pneumomediastinum may experience a cough, hoarseness, neck pain, shortness of breath, trouble breathing, vomiting. Precordial catch syndrome. Precordial catch syndrome arises when nerves in the chest are pinched or squeezed. It can typically present in children, adolescents, and people in their early 20s. It is not usually harmful, although alarming. Symptoms include sharp chest pain that comes on suddenly and a bubbling sensation. Symptoms typically disappear with age, but there is no treatment. Other causes. A gurgling or bubbling feeling in the chest may also be linked to other conditions such as air embolism, angina, anxiety and stress, heart attack, myocarditis, which is an inflammation of the heart muscle. If anyone experiences a bubbling feeling in their chest, it is crucial that they consult a doctor. Although the bubbling may merely be indigestion, it could be a sign of something serious, such as a tumor or collapsed lung. Anyone who experiences the following symptoms should seek emergency medical treatment. Difficulty breathing, especially if it starts suddenly. High fever, inability to stand up and or walk properly. Irregular pulse, numbness in the arm or side, pain that spreads to the face or neck, severe abdominal pain, severe vomiting.